That's correct. And do you sometimes wear your earrings overnight instead of taking them out? Mm-hmm. Mm-hmm. Okay. So this might have contributed a little bit. I am going to ask you to turn your head first to show me your right ear and to try to spread the lobe a little bit with your fingertips so I see how the opening occurs. Yeah, that's good. Perfect. Okay. And now, if you can show me the other side, please. And you have to go, yeah, you're going out of the, yes, almost. Yeah, this is good. Perfect. Okay. Good. Perfect. Thank you. So what I see are slightly elongated piercing sites, but the bottom rim of the earlobe is still very well intact. And so this makes obviously a difference also for the repair and how we can restore it. Now it appears on the left side it's a little less than on the right. Am I seeing that correctly, or is this an illusion on my video photography? Mm-hmm. Right. So sometimes it is possible when the elongation of the piercing site is relatively small enough, we might not even have to do a surgery, and we can use filler to reinforce the tissue around the lobe. So if you think about this kind of small slit area, and if it is enforced from the outside with filler, then it is oftentimes possible to not even have to undergo surgery, and that is a feasible option for some of our patients who have small enough elongation sites that we can close, and the filler closing typically lasts about 2 or 3 years, so it's pretty useful technique. It would also come with the sense that you don't wear earrings overnight anymore, because that can contribute to this elongation of the piercing side. Now, I think on the right hand side it might be just a little bit too long to be able to do this in a meaningful way with the filler. So I think for the right hand side, in the least, I have to discuss a little bit surgical options, but I need you to know beforehand that when we are going for a surgical option, it is not possible to maintain a piercing site at the site where it currently is. So in other words, if we are repairing anything on our body, anywhere on our skin, the scar is simply a compromise. It's a good way of closing. Let's say if you have a fracture, it's a nice way of making this bone functional again if the scar occurs and the bone heals after the fracture, but it never will have the full strength of how it was before. In other words, if you were to want to continue to wear earrings, a piercing site about 3 millimeters away, and that is about 1/8 of an inch away from the current piercing site, would have to be chosen as the next piercing site. And now I'm going to have you turn one more time on the right, sideways, and you see that your piercing site, the original one, is in a very, very optimal position. And you can turn to face me again. And considering that it was optimal when you were first pierced, probably during your childhood or younger years, then another piercing site would move outwards, so away a little bit from the face, again about 1/8 of an inch, which is not all too much, but overall you need to take that under consideration when going for the surgical option. The surgical option is relatively straightforward for me because I'm doing this repair all the time. It takes 2 types of medicines that I'm using for this, and that one would be the numbing medicine. Have you ever had any numbing medicine, let's say at the dentist's office, any Novocaine, Lidocaine? Have you ever had any allergic reaction to it? Okay, so then there's no problem with this. And the other medicine that I use is for the aseptic technique on the ear, we use iodine, and that is in order to reduce the count of bacteria that normally sit in the ear canal, and that would be Pseudomonas, and iodine is a very safe antiseptic in the ear area, so we would use that. Do you have any iodine allergy?
No, the only
The contrast, the CT scan? Yeah. So this contains iodine, and so do you ever eat shellfish? Can you eat shrimp? Okay, so it is probably just an injectable issue. I might still want to be careful as to how much iodine I use. We always wipe it off after the procedure, but I will make a note of that and be very, very careful. So the actual slit that has occurred is then after the area is numb, and the numbness is achieved after just about a minute or so. I will actually take a small slit around the area that is now that elongated opening. I will take that out and bring the skin together so that it's even leveled, and then we'll close it with a couple of sutures in the front, a few sutures in the back. Those sutures are removed after 1 week, but any piercing can only occur, let's say, in order to restore a new piercing site, can only occur 4 weeks after the surgery in order to assure the scar the time to heal and the ability to create stability. The procedure takes a little bit of time. It can take between 20 to 30 minutes, and it is not because it's technically difficult. It's for the artistry to really take place. So in other words, we don't want to create steps or folds or anything like that. We want to have a beautiful looking earlobe as an end result, and not just, you know, closing something up in a hurry. And so it does take a little bit of time. Your time in the office can easily be about 45 minutes to an hour when we can do the surgery. And that is the prep time, this is my surgical time, and it's also the time to place a little bit of a dressing, which is slightly challenging on the earlobe, but we do it all the time, so it's not so bad. And then you'll have that bulky dressing that you will have for 24 hours, you're going to remove after 24 hours, and then there's going to be a very, very thin wound covering. We're going to show that to you during the time of the surgery, or right after the surgery, so that you see what wound covering stays in place for about 3 or 4 days after, and it unravels itself, and then 7 days after the procedure you come back for suture removal. It is going to be, there's not going to be any pain involved in the procedure. The numbing medicine causes a little bit of a, you know, unpleasant stinging sensation, but that's over after about 20 seconds. And even after the numbing medicine wears off after 2 hours, there's not going to be any particular pain. You might feel a little soreness. And all you do for those 7 days until the sutures are removed is wash the ear, like your whole body, in the shower once a day with water and soap, and then put a tiny bit of Vaseline or Aquaphor right over the surgical repair site. So it's very, very straightforward in that particular sense. Any questions so far?
So you would do that on the right ear. Could you, if I opted not to do filler, could you do it also on the left ear?
Absolutely. And
so the filler is not really permanent.
no, you're right. That is not a permanent option. It's just a really good option in some people because the defect is so small. But on the other hand, it is not impossible to repair. It's not like there's a piercing site that is ever too small to be repaired surgically. And if otherwise the volume of your earlobe is, when you feel your earlobe, and you feel there's pretty good substance, surgery is really a really good option because it's a permanent option.
Yeah, my earlobes are very thick.
Very good. Okay, so then we should be planning for surgery. All right, any questions that go to the medical side of it so far?
No, I mean, like, so you know, like everybody, I'm working from home, but I do have an option to work from home.
Mm-hmm.
A couple days a week, I am in jail, I do have to sometimes go out.
Mm-hmm.
What would be my, and I don't expect to be going out, I don't know, maybe, who knows with what's going on, but, so what would my downtime be in terms of,
Mm-hmm.
because I'm not gonna go out, you know,
Oh.
but whatever, you know.
Mm-hmm. Okay, so since the sutures need to stay in place for 7 days, your actual downtime can be 7 days. The bulky dressing is only there for 24 hours, and since there's this very thin white covering over the area, for many of our patients will go normally to work. They will not actually take off. They might wear their hair down if that's an option, because that actually conceals it altogether. And even once this white covering unravels itself, you could theoretically put just a band-aid over the area and conceal the sutures so nobody actually sees the sutures. So it's not absolutely a hindrance unless you feel this is not presentable. What kind of sales do you do?
Actually, medical, so I do data,
Mm-hmm.
data and analytics to, you know, the big hospitals and health systems.
Mm-hmm.
So, I do a lot of it,
probably.
Yeah, I'm hoping in Florida, but,
Oh.
I know.
Yeah.
But I don't have a lot of meetings, and I'm just thinking, like, when I schedule it, I'm just, if I had to attend a meeting, but I probably would cancel. I'm just kind of thinking out loud.
Yeah, of course. And you will have all of that flexibility. At this moment, it's really difficult for us, obviously, to foresee when the office can open up again. Kind of, in general, our schedule is open now from the end of June, so that we, at least can put some of our more, urgent patients there. But generally, it's open. Hopefully, that will be the case. And if you wish, we can have you already scheduled for, let's say, that last week of June, or you can call us and let us know when is a good time after the office reopens. If the office can reopen beforehand, you can certainly also have the surgery beforehand.
Yeah, this isn't, for instance, I can do June, I can't do June, sorry.
Very good. Okay. Let me just go over a little bit of the pricing. The repair is not an insurance submittable service because there's no impairment or in functionality when an earlobe tears, and so insurance has excluded that as a submittable service. Each repair is $375, and for the timing, if we want to repair both, we would just create a little bit of a longer time slot for you. That's not problematic. When you schedule, you just basically say, I'm going to have both sides repaired so that the schedulers can allocate that appropriate time frame.
Do you recommend doing them both at once?
Yeah, most of my patients like it because then they're done with it, and then they can wear their earrings again. Oftentimes, people have an event that they would like to wear the earrings for, and they kind of just do it all at once.
I have a question. With the re-piercing, do you guys do that?
Yes. Yeah.
Yeah.
I hear you. Yeah, so our estheticians actually perform this service. They are trained in doing the re-piercing after earlobe repair because that's what we do all the time. Now, if you had a piercer who knows how to do it well and who knows how to respect the distance, I have no objections that you use somebody else, but our estheticians do it. The service is $25 for the piercing. It's not per each, but for either both sides or one side, doesn't really matter. And we'll give you another earring to match the other side. Should we choose not to do the second? But I think it's going to be probably likely that we're going to be doing both. Yeah, good. Overall, do you have any medical problems? Have you ever formed any unusual scars? Anything that have you ever had a surgery? Well, then we don't know what the scar on the skin would look like because it doesn't involve the skin.
Right.
Okay.
Yeah.
Any other injuries or cuts or accidents anywhere on your skin where you formed a scar?
No.
Okay. All right. So it's tough to say if there's any possibility for unusual scar formation, but in somebody who's fair-skinned, the likelihood of a keloid is very, very small, almost non-existent. Okay. And overall, do you feel healthy?
Yeah, overall I do.
Okay. Do you take any supplements, any vitamins, anything that might not be medication? And what are the? And is any of those vitamin E?
No, I don't take E.
Okay, good. Because there are a few things that we would not necessarily want you to take just right about 7 days before the surgery, and these things include aspirin, ibuprofen, fish oil, ginkgo, St. John's wort, and vitamin E. And these are the things to try to possibly be avoided for about 7 days before the surgery.
I do take the fish oil. I do.
Mm-hmm.
Oil as well.
Good. And you can restart those right after the surgery. It's not a problem. It's just the 7 days before that I don't want you to take it because they increase oozing. And that if fish oil is not absolutely essential for you to take, then it is possible to minimize the amount of oozing. Okay? Good. All right. So I think what I'm going to do you have any additional questions right now? Good. All right. What I'm going to do is I'm going to have the office reach out in a little bit to you to schedule the appointment. Maybe you can take a look already at your calendar, and then we can have the appointment on the books. I think there's a little bit of a deposit that we're asking for in order to hold the length of time in order to do the two together. But other than that, there's nothing to be kind of. Well, I'm glad that you had a good experience doing that telemedicine appointment.
Yeah, it's very, very good. I think that this is definitely the future.
Yeah.
Or it's the now, you know?
Yeah, right now it's the now, and we are fortunate that we are in a world where we could very easily make this all a HIPAA compliant experience, and we're using only those kind of platforms. Everything is fairly streamlined. I'm glad that you had a great experience so far.
Yeah, very good.
Okay. All right, I'm looking forward to seeing you in the office. As I said, I'm going to have one of our schedulers reach out during the course of the morning to schedule that appointment. We'll take it from here.
All right, thank you. Thanks so much.
It was a pleasure.